Fearful attachment is a type of attachment style characterized by a fear of intimacy and rejection. People with fearful attachment often have a negative view of themselves and believe that they are unlovable. They also have a negative view of others and believe that others will eventually reject them. Fearful attachment style is often developed in early childhood, when a child does not experience consistent and reliable love and support from their caregivers. This can lead the child to believe that they are not worthy of love and that others cannot be trusted. As a result of their negative view of themselves and others, people with fearful attachment style tend to avoid close relationships. They may also have difficulty maintaining relationships that they have. People with fearful attachment style may exhibit the following behaviors. 1. Avoiding social situations. People with fearful attachment style may avoid social situations because they are afraid of being rejected or humiliated. 2. Having difficulty trusting others. People with fearful attachment style may have difficulty trusting others because they believe that others will eventually abandon them. 3. Being afraid of intimacy. People with fearful attachment style may be afraid of intimacy because they believe that they are not worthy of love or that they will be hurt. 4. Having difficulty expressing their feelings. People with fearful attachment style may have difficulty expressing their feelings because they are afraid of being rejected or judged. 5. Having a negative view of themselves. People with fearful attachment style often have a negative view of themselves and believe that they are unlovable. Fearful attachment style can have a significant impact on a person's life. It can make it difficult to form and maintain close relationships, and it can lead to feelings of loneliness, isolation, and depression. Causes of fearful attachment. The exact causes of fearful attachment are unknown, but it is thought to be caused by a combination of genetic and environmental factors. People with a family history of anxiety disorders are more likely to develop fearful attachment themselves. Additionally, certain life experiences, such as trauma, stress, and abuse, can increase the risk of developing fearful attachment. How to identify fearful attachment? There are a few signs that you may have fearful attachment. 1. You avoid close relationships or have difficulty maintaining them. You have a negative view of yourself and believe that you are unlovable. You have a negative view of others and believe that they will eventually reject you. You have difficulty trusting others. You are afraid of intimacy. You have difficulty expressing your feelings. If you think you may have fearful attachment, it is important to talk to a therapist. A therapist can help you to understand your attachment style and develop coping skills to manage your anxiety and fear. How to cope with fearful attachment. There are a few things you can do to cope with fearful attachment. 1. Challenge your negative thoughts. When you have a negative thought about yourself or others, challenge it. Ask yourself if there is any evidence to support the thought. If there is no evidence, try to replace the thought with a more positive one. 2. Practice self-compassion. Be kind and understanding towards yourself, even when you make mistakes. Remember that everyone is worthy of love and respect. 3. Set boundaries. It is important to set boundaries in your relationships. This means letting people know what you are and are not comfortable with. It also means saying no to things that you do not want to do. Seek professional help. A therapist can help you to understand your attachment style and develop coping skills to manage your anxiety and fear. It is important to remember that you are not alone. Many people have fearful attachment. With time and effort, you can learn to manage your anxiety and fear and build healthy relationships. Here are some additional tips for coping with fearful attachment. Identify your triggers. What are the things that tend to make your anxiety and fear worse? Once you know your triggers, you can start to develop strategies for avoiding them or coping with them when they do occur. Create a safety net. Surround yourself with people who support you and make you feel good about yourself. These people can be friends, family members, or a therapist. Join a support group. There are many support groups available for people with fearful attachment. These groups can provide you with support and understanding from others who have similar experiences. Be patient. It takes time to change your attachment style. Don't get discouraged if you don't see results immediately. Just keep practicing the coping skills that you're learning, and eventually you will see improvement. Remember, you are worthy of love and respect.